Hi, I'm Jami Kinnucan at the Mayo Clinic in Jacksonville, Florida, and I'm looking forward to chatting with you a little bit today about cannabinoids and the impact in GI illness. This is something that we're starting to see more and more frequently, and so there's three common questions, at least, that I'd like to start with. Question number one is, more and more patients are using cannabinoids either for medicinal purposes or recreational purposes. What are some basics that you need to know as a provider? First, when we look at the cannabis timeline, cannabinoids have been around for 4,000 years, back into the early Chinese days in Chinese medicine where cannabinoids were first discussed. And then when we fast forward now, just 30 years ago, California was the first state to introduce legislation about medicinal cannabinoids. And now we're here today, and you can see on this slide that we have varying legalization throughout the country. Some states with medicinal laws, some states with recreational laws, and some states where it's still illegal. However, on a federal level, cannabinoids and cannabis remain federally illegal as a Scheduled 1A substance, similar to that of heroin. So what are some of the basics that you need to know about cannabinoids? Well, basically, cannabinoids have many, many strains, but the two that you'll most commonly hear are cannabis sativa and cannabis indica. And then there's cannabis rudalis, which is a cannabinoid strain that has high flowering potential, but not a lot of CBD or THC, and so it's often combined in hybrid form. Cannabis sativa, when we talk about that, we're thinking about marijuana, which is CBD and THC at higher doses, versus hemp, which is CBD predominant with very low levels of THC. Cannabis indica is also marijuana and predominantly CBD over THC. I want to talk to you a little bit more about cannabinoids in general. Cannabinoids, when we think about the two phytocannabinoids that you'll most commonly hear from patients, we're talking about delta-9 tetrahydrocannabidiol, THC, or cannabidiol, which is CBD. Cannabis acts at the endocannabinoid receptors within the body. And there are three main types of cannabinoids: phytocannabinoids, which is THC and CBD; synthetic cannabinoids, which there's many that have been made and approved in the US that are either in the form of THC or CBD analogs; and then endocannabinoids, which are actually inherently part of the body, and they act at these receptors and can modulate the immune system. This is a very simplified overview of where these cannabinoid receptors are within the body. CB1 receptor is predominantly within the CNS or enteric nervous system, whereas CB2 can be found on peripheral immune-mediated cells and in peripheral organs. And CBD and THC are these main phytocannabinoids and have varying affinity for these receptors, mainly THC acting at CB1, giving those psychoactive effects, and CBD acting mainly at CB2, which is where we can see that immune-mediated potential. Our patients are coming in using cannabinoids in various forms and doses and frequencies and THC amounts. So it's important for you to know as a provider all the different formulations that you can see on this slide. We know that when patients use cannabis by inhalation forms, it has a faster onset and a shorter duration. And we know when patients are using cannabinoids in an oral route or a topical route, we know that the duration is longer and the onset takes longer. These are some basics about cannabinoids to help guide you in your practice with patients.